Sharp safety in the operating room. Did you know that sharps injuries are the #1 incident faced by nurses in the OR? Most of these injuries are self-inflicted, meaning nurses are unintentionally hurting themselves. Our hospital policy states we must consider all sharps to be infectious. We must utilize a neutral zone and the hands-free technique whenever appropriate. Sharps must be placed away from the scrub nurse on the far side of the Mayo, and during hand-to-hand transfer of sharps, communication is key. Can you spot the hazard in these photographs? On a back table, all sharps must be contained near the red discard pad. We will now hear from some of our colleagues regarding the safe loading of sutures, blades, and the discarding of them.
All right, so now I'm going to show you how to load a suture without manipulating with your hands. So first things first, you identify the suture that you want and then find the appropriate driver to your suture. So I have a #1 Vicryl and I'm going to have a Mayo driver. So what I'm going to do is put it at like about a 90-degree angle. And I'm holding the suture pack when my finger is far away from the suture and it's inside the package. And then I'm going to put it up to 2/3 to 1/3 of the suture. And I click it nice and tight, and then I lift it out of the package, and there you go, ready to go, loaded for the surgeon. I get it ready to hand over and give it to the surgeon this way without touching it at all.
Okay, when loading our blades, we want to make sure we use an instrument. My instrument of choice is my needle driver. So I'm going to pick up my blade here at a 45-degree angle and load it onto my driver like so. When removing, I'm going to flip it upside down, aiming it towards my sharps container and dropping it on the magnetic side, avoiding putting it in my foam piece there. An alternative method to getting rid of our blade would be to use our blade flask. If you're confused, there's a photo here, just like so, and the blade's gone.
Now that you've learned how to load the suture properly, we're going to go over discarding. So there's 2 methods that we can do this properly without manipulating the suture with our fingers. First method is you're going to take your protected needle back from the surgeon. You're going to drop it on your table, and then you're just going to pick it up and put it into your discard pad. Now the second method would be to use a forceps. So you would take a forceps. Okay, you would just slightly manipulate the stitch and then put it in your discard pad.
Thanks for the demonstration, nurses. The key take-home message is that you must use an instrument when handling a sharp. We want you to go home safe and protect yourself.